Accidents happen every day. However, the availability of efficient and swift pre-hospital care would make a difference. Today on Sound Health, our focus is on how to optimize pre-hospital care and optimize emergency health services in Lagos, Nigeria. Good evening. Welcome to Sound Health on Lagos Television. I am Olasumbo Modupe. The conversation begins after this break.
Is the world better prepared for the next pandemic than we were for COVID-19? The answer is yes and no. If the next pandemic arrived today, the world would still face some of the same weaknesses and vulnerabilities that gave COVID-19 a foothold 5 years ago. But the world has also learned many of the painful lessons the pandemic taught us and has taken significant steps to strengthen its defenses against future epidemics and pandemics. Together with the World Bank, WHO established the Pandemic Fund, which is now financing 19 projects in 37 countries with $338 million in grants. WHO has supported many countries to strengthen their lab capacity to detect and sequence pathogens, and we established the WHO Hub for Pandemic and Epidemic Intelligence in Germany to foster collaborative surveillance. To improve local production of vaccines and other medical products, we established the mRNA Technology Transfer Hub in South Africa and a global training hub for biomanufacturing in the Republic of Korea. To improve equitable access to life-saving tools, we established an interim medical countermeasures network. With partners, we established the Global Health Emergency Corps. In May this year, the World Health Assembly adopted a package of amendments to the international health regulations. Our member states continue to negotiate the WHO Pandemic Agreement. They are committed to finalizing the agreement in time for the World Health Assembly next May. I remain confident that they will.
The program is still Sound Health on Lagos Television. According to the World Health Organization, emergency health services is important for accident care. Joining us via Zoom this evening is Dr. Stephen Akeremale, a Nigerian serial entrepreneur with over 15 years of experience in pre-hospital healthcare services. He leads Braingrace Medical Services Limited, Repatriation and Funerals, as well as Dr. ASA Auto Fabrication and the Dr. Stephen Akeremale Foundation. His educational background includes an MBBS, an advanced degree in business and biomedical engineering. Good evening, Dr. Akeremale, and thanks for joining us.
Good evening. Thank you for bringing me in here.
All right. Thank you so much for finding time. Let us start with the goal of emergency. Why do we need to provide pre-hospital care for people experiencing a health emergency? And how do you ensure this vital purpose is not undermined?
Thank you very much. Emergency ambulance response is critical and is very, very important. Number one is that life has no duplicate. And because life has no duplicate, we need to prepare for emergency. Another very important reason is that most lives there are many lives that are dependent on people. For instance, a father, we have children, we have wife, we have relatives. So when a life is lost, we are not talking about that very life. We are talking about a lot of people that are dependent on that very life for survival. And because emergency will not give you notice, of course it will come, but it will not notify you. So it's very important that there must be adequate preparation for it, while expecting the occurrence.
Okay, Dr.
Thank you.
Akeremale, you pointed out something now. You said emergency is not prepared for, our accidents are not prepared for. But how do you prepare for this unfortunate, unforeseen circumstances, and are there criteria for this service, for accessing this service?
Yes. What I meant was that emergency will not notify you that you are going to have an emergency today. Somebody who wakes up in the morning and is on the way to work may not imagine that accident can occur. But of course, accident or situation that warrant emergency will occur. So it's very important that we prepare for it. Number one, every individual should have their own personal physician or personal doctor that can be contacted immediately emergency occur. In fact, in some advanced countries, they carry some things along everywhere that when emergency occur and probably the patient is unconscious, checking the pocket, they can find some documents that can help to identify who is this person, who is the personal physician, and something like that. So in our own environment, it's very important that we prepare for emergencies. And one of the ways we do that is by having ambulance services that are functional and that can easily be accessed and can be affordable.
Okay, I'm glad that is your field. You are an expert in that field. You've garnered expertise in the last more than 2 decades, if I'm not wrong now. And you've also pointed out that in saner climes, we have standby emergency services. How do we ensure we step up this need in this space?
Okay, number one is that most of the advanced countries, government, they take a lot of responsibility in doing this. And the Nigerian government, they are doing a lot concerning this. But there's limitation to how far government can go. So there's a need for private collaboration with government agencies. And that is the space in which we decided to contribute our quota as a private company, knowing fully well that government may not be able to do everything. So private companies should come into the space and support the government of the day to ensure that emergency ambulance response is available and is affordable.
Okay, share with us the most important and the first criteria that is needed during a critical situation for a patient and all that.
Okay.
How am I qualified for this service if there is no provision in place?
Well, if I can understand you, every living creature in a country, you have basic knowledge of how to handle emergencies. And that is why in many companies, they make it a routine that training and retraining should be done. That before the ambulance arrives, those that are witnessed of the critical situation should be able to do some things before the ambulance arrives. For example, cardiopulmonary resuscitation is key, and everybody should be able to have knowledge of this, of what to do. For example, if somebody is unconscious on the floor, passers-by should be able to know that cardiopulmonary resuscitation should be done for this patient, how to assess that patient. Every individual is supposed to know that. That's the first step. So there should be training at the level of every organization, at the level of even as a family. They should be trained on how to handle emergencies. Unlike, in many developing countries, when emergency occur, people tend to pray, people tend to watch and start taking pictures, people tend to pour water, on that very person. Why? Because they have not been trained to know exactly what to do. So training is number one key that everybody should know. Another thing that is very important is We have to overcome the bias, the religious bias. You know, if I ask now, how many emergency ambulance response phone number do you have as an individual that you can call? And I remember, in order to ensure that everybody have access to emergency phone numbers, there was a time I got bulk SMS, and I send messages to people. Save this number in case of emergencies. The response will be, the responses, they were so embarrassing. People will call you and say, why do you think I will need an ambulance? I shall not die, but live to declare the word of God. This is not my portion. Delete me from your broadcast now.
Wow.
And some of them will go ahead to curse you that you are prophesying evil. So this kind of group of people, they forgot that either you like it or not, emergency will occur. So it is when emergency occur before they will start calling, they will rush to a nearby hospital to go and ask the doctor where they can get an ambulance. But this is one of the challenges we have in this part of the world. Everybody should have emergency ambulance contact on their phone that they can call when emergency occur. And many other things like that. Another thing that is very challenging is the issue of insurance, because emergency, like I said, we know alert you. So when it occurs, at that point, even those who are rich, those who have money, they may not have access to their money at that time. So it's not a kind of situation where when you call an emergency ambulance, they will say, we will not be talking about money. It's very wrong. So there should be a kind of insurance setting that when an emergency occurs, ambulance service is supposed to be deployed, either at the level of government or at the level of private. Deploy an ambulance, and when you have done the job, you may be able to send your bill to appropriate quarters. You know, so we need to get to that level in Nigeria. So we need to go above a situation where emergency occur and somebody is talking about money, where somebody's father, somebody's daddy, somebody's uncle is in a critical condition. So we still have a lot to do concerning that in this country. Of course, like I said, government is doing a lot, but I can tell you, looking at our population, there's limitation. Private individual and private private establishment must be involved in that. Thank you.
Okay, I'm glad you mentioned the fact that we need to reorientate ourselves. We also need to ensure we allow, give space for private partnership. We also want the government to also reach out to these private individuals, private organizations, so as to fill this vacuum that the need has created. Okay, let us look at other challenges in this space. In these settings, especially Lagos or any part of the world or any part of Nigeria, we see that when there is an emergency situation, many people, maybe out of overzealousness, you know, they prevent the first responder from getting to the scene. Or would you say it is out of overzealousness or out of, you know, sheer empathy?
Okay, you know, I'll be talking from experience. You will not believe that at times, even our regulatory agencies, they need training. We have situations where emergency will occur and ambulance service will be rushing to that place. Some of the, many times we get stopped because we don't have special lane for emergency ambulances. We don't have special lane in this part of the world, in most cases. And when you take dedicated lane in order to be able to catch up with emergency, in most cases, you know, regulatory agencies, they are likely to stop you. And even when you explain to them that, of course, there's nobody in this ambulance, but we are rushing to pick people, many times they will not allow you to move. They will not, they say, no, it's not correct. You understand? So we have a lot of things, we have a long way to go in make sure that we overcome that. So I don't know if I'm able to answer your question.
Yes. All right. The World Health Organization recommends that accident care must include improved data system How do you think we can employ technology to achieve optimal services? Use of telemedicine and all that. Do you think that will work or enhance this service?
Yes, and I'm sure that there are many companies in Nigeria that that have gone into technology, but technology may be very difficult if you don't have data, about data of people in the country. In advanced country, once you give them your pain, automatically they know your hospital, they know your primary physician, everything about you is known. But in this part of the world, I'm sure we'll get there one day. A situation where somebody is hit on the road and the passerby calls emergency ambulance and we rush there. You know, start resuscitation, en route hospital, but getting to the hospital, it becomes very difficult that this patient has no relative who will take care of the patient. So it's difficult for hospitals most of the time to admit that patient. So we see at times, you know, we need to donate some of our staff to act as relative, you know, and call a lot of people before that kind of patient can be admitted. And we have seen cases whereby some of our staff will be there for almost a week. We're trying to locate the relative. So this one is very discouraging, you know, but if you have data, you know, by just looking at probably the driving license or any document with the patient, you should be able to know everything about this patient, and it may help emergency ambulance response or healthcare delivery to that patient. So the importance of technology cannot be overemphasized.
All right, thank you so much, Dr. Akeremale. Let us look at going forward. What would you like to see differently in critical health situation, emergency health responses and all that? What would you like to see differently?
We want a situation where government agencies that are signed for emergency response to partner with private ambulance response companies and be able to deliver. A situation where government can partner with private individual and say, okay, whenever emergency occur and you are called, respond to that emergency, then send us the bill. In that case, we won't be waiting. Emergency will not call and say, this is your money, you need to pay this, you need to pay this. You understand? So we have to get to that level. Government should realize that they may not be able to do. They are doing excellently well about it. But, you know, there's always room for improvement, especially looking at our population. So that's number one. Number two is the issue of security. At times in the middle of the night, when emergency occurs in some area and our ambulance service is called, we are scared to move at that part of the day. At times we need to liaise with police in that environment and therefore rush to a police station, ask them to assign a police to the vehicle, to the ambulance for security. Because we have seen a lot of attack on our vehicle in attempt to respond to emergency in the middle of the night. So these are those I'm looking towards, whereby there will be collaboration between police posts nearest to anywhere the ambulance center is. So when there's any emergency, especially at odd hours, we can always approach the police station to ask them to assign some police officers to the vehicle so that the clients will not lose their life where to save the life of others. And also the issue of insurance is very important so that people will know, because everybody will not be sick at the same time. But the burden of healthcare is enormous. So, but if there's insurance and you know that when emergency occur, you are not going to bear the burden on your own. And good care is going to be given to you. It will lessen the burden of healthcare.
All right.
So those are the issues that you should look into critically.
All right, Dr. Stephen Akeremale, thank you so much. And I'm afraid we cannot go more than this on the program. I believe you will find time in the nearest future to oblige us again to talk about critical health solution and other health emergency response services, because I know it is a broad topic.
Thank you very much. I hope so too.
I have been speaking with Dr. Stephen Akeremale, critical care specialist and managing director, Braingrace Ambulance Service, on how to optimize emergency health services in Nigeria, especially Lagos State. Sound Health continues with trending health reports from around the world. Please stay tuned. This is where we say thank you on today's episode of Sound Health. Remember, accidents or emergency are not prepared for, but you need to be swift to get adequate help and care. For that to happen, reach out or call any of the emergency numbers at your reach. For comments and inquiries, or you have topics you'd like us to treat, please send SMS 30035826603 or follow us on social media at Lagos Television #Sound Health. A sound health is a sound mind. Make healthy living your choice.